Josh has presented, I think, is very important in terms of how data for approval of medications is done and how it should not be done. As Tess said, we have enough evidence that what's happening now needs to change. The tissues of the human body don't lie. So as a pathologist, we get to glimpse inside the human being, and we get to glimpse inside what happens. We are the reporters at the scene of the accident in the human body. And so what I'm going to present very quickly is work of several European pathologists, Dr. Arne Burkhardt and his group, some of my findings as well. And we're inviting all pathologists around the world to step up and do your job. We have the tools, you know we have the tools, we've had them for decades. We can prove whether or not a death was caused by this shot, this gene injection or not. And I'm going to show you how very quickly. So any cell in your body now can make the spike protein. Here's the team. This looked at over 50 autopsies. I'm going to do an aggregate. I'm not going to show you 50 autopsies. I'm going to show you aggregate findings of what we find. So what does the spike protein do? Harms. It suppresses your innate immune system. We've seen that in laboratory data. Reactivates viral and bacterial infections and other latent organisms. It causes inflammation in any and all tissues. Can trigger autoimmune disease. It has many mechanisms that overlap that can increase cancer rates, and we know that it causes extreme clotting. In the J&J, we saw that they put a black box warning by the FDA on it because of clotting, but interestingly, in the Veris data, there's more clotting events from Moderna and Pfizer, yet they don't have a black box warning. All right, in the studies we've seen so far, we can correlate about 80% of those deaths to the shot itself. This is how we do it in the laboratory. That brown staining is called an immunohistochemical stain. We are able to mark the spike protein in the tissues with an antibody, and then we're able to use a second antibody to light up so we can see it under the microscope. And this is what it looks like in cells. And here are muscle cells, and all those brown dots are the spike protein. Now, how do we know it's from the shot? Well, the virus has many proteins, and if it's from a natural infection, the N protein, the nucleocapsid, would also light up. So all these studies are done for spike against nucleocapsid, vaccinal versus natural infection. And we always run positive and negative controls. Here you can see that that spike protein, once it starts circulating and proliferating in the bodies of the cells of the person that received the injection, we can see the spike protein being expressed in the blood cell lining. Here we see it in capillaries of the body. Again, this goes everywhere, and now every and any cell in your body can become a spike protein factory. When the spike protein is in these vessels, inflammation ensues, and that inflammation can become extreme. Here we can see spike protein in the tissues of the brain. All those brown dots is spike protein, S1, in the tissues of the brain. From early on, as studies began, we knew this S1 fragment can cross the blood-brain barrier. You want to know why people have brain fog? They have spike in their brain, which induces inflammation. Here in the walls of the vessel of the brain, you can see how it migrates into the brain cells. That little tube that's all brown, that spike protein lining the vessel in the brain. And all those dots out there, that's why those neurons aren't firing. They are inflamed. Their mitochondria are being destroyed by the spike protein from a shot that carries a gene that makes your body a toxin factory. Here you can see, in this same patient, negative. That's the nucleocapsid stain. We compare one against the other. That was from the shot, not from the infection. I'm going to skip that one. Just interesting how the spike protein starts to fragment cholesterol deposition. So when you hear, oh, we see these strange things under the microscope and people conjecture what they may or may not be, by mass spec studies and many lab studies, they tend to be fragments of cholesterol floating through the bloodstream. They're not chips, they're not heebie-jeebies, they're not strange things. Also, the spike protein is causing an interesting thickening of the blood and thickening of proteins being deposited. This is called amyloid. I won't give you a long medical lecture on it, but again, in the tissues, the spike protein is causing other proteins to thicken and deposit in blood vessels. Here we can see, again, spike protein in vessels. This is a biopsy of the skin and the blood vessels in the skin. Now, it also deposits in the large vessels. This is the aorta, the biggest artery in your body. And what happens is the spike protein starts to deposit. All those blue dots are inflammation, and then we stain those, also staining the lymphocytes, and this is, we can just see the aortic wall shredding apart. And when we stain it, it's full of spike protein. That spike protein induces inflammation. All the chemicals break the tissues of the body apart. Here we can see tons of spike protein deposited in the spleen in one of the deaths. This one, we can see almost an onion skin of brown surrounding larger vessels in the body, and almost every cell in the spleen is replicating spike protein. Other findings in organs, myocarditis, inflammation in the lungs. Here you can see scarring in the heart. So when you hear of myocarditis and you hear doctors say, oh, this child had myocarditis, it's mild. See all that white? That's scar. After myocarditis, the heart scars. There's no such thing as mild myocarditis. And there have been radiology studies in children who had myocarditis from this vaccine that several months later have scar in their heart. That means dysfunctional heart for a lifetime. This is all blue. Those are lymphocytes in the heart muscle. That's what myocarditis looks like. And here you can see on the left, that's heart muscle with spike protein in one of the deceased patients. On the right, nucleocapsid negative. This is from the vaccine. In the lung, same thing. Lots of spike protein deposited after the shot. Lymphocytes and inflammation everywhere. We know, in addition to the spike protein, these shots dysregulate your fat metabolism in the body, your lipid metabolism, which can have grave implications for the heart, for the kidneys, and for the liver. This is not a normal liver. This is incredibly inflamed, and fat is being deposited in the liver, and then the liver begins to not function over time. Also, autoimmune disease. This one is skin. All that blue should not be there. After a shot, we know we're seeing countless types of autoimmune disease activate. Thyroiditis, skin conditions, and all sorts of other conditions. Viral reactivation. After the shots, there are countless papers now in the literature showing that multiple types of viruses in the body can wake up. That's because these shots suppress the immune system. And the cells that keep other viruses in check are now asleep. And now these viruses can wake up left and right. This is a case of molluscum contagiosum. We usually don't see that in older people. Now we see it a lot. Herpes virus infections, we see it a lot. That's what it looks like under the microscope. CMV, cytomegalovirus. Normally we don't see a whole lot of that. It's waking up again as well. Extreme clotting. This patient lived, but this was after their second injection, and this was extracted by an interventional radiologist. These are unusual clots in the sense that they have different proteins that they normally wouldn't have. These patients unfortunately did not make it, and these are thick fibrous amyloid clots, and multiple are from the veins, and the one on the far right is from an artery. We don't see that very often clinically. And these clots are thick, and that's that pale amyloid protein material. Here you can see a marathon runner having trouble with circulation in the feet. We've heard a lot of COVID feet and toes. Well, the vaccine does the same because that spike protein deposits and causes inflammation and chokes off circulation.
Audio Jungle.